My research paper was about examining the efficacy of individual treatment methods compared to a combined comprehensive treatment approach in managing polycystic ovarian syndrome. PCOS is polycystic ovarian syndrome, and the main issue with that is that it causes long-term infertility. Its diagnostic criteria is defined by irregular periods, biochemical or clinical signs of elevated testosterone levels, either through a blood test or facial hair on women, and also through polycystic ovaries. Although the issue with that is that in order to make a PCOS diagnosis, you only need 2 of the 3 criteria. So it's slightly misleading because you technically don't need polycystic ovaries to have PCOS. My best friend who goes to UCLA, she suffered through a life-threatening ovarian cyst. She was walking up the hill back to her dorm, and she called me and she was like, I am having really bad cramps. This isn't usually normal. What should I do? And as a woman, I'm like, oh, they're probably just like cramps, just take some Advil and you'll be fine. She goes to the emergency room and they said that if she had come 3 hours later, her ovaries could have ruptured and she could have lost her life. It was that serious. And I think that's what really showed me wow. I didn't even know what an ovarian cyst was until that happened to her. No one tells you that these things actually are more common than you think. They could happen to anyone. So I think kind of just for me, raising awareness about women's health issues was my primary goal when writing this research paper. And that's kind of what drew me to the topic in the first place. So I think this research process was really personally and professionally rewarding. I think it kind of sparked my interest in pursuing a medical career in women's health, specifically reproductive endocrinology, because that requires a very comprehensive care plan. I want to be directly involved with all of my patients. I don't want a surface level relationship. I want to know everything about them, and I want to support them in whether that be wanting to get pregnant or just supporting their hormonal health and living a normal and healthy life. When I picture that moment, just seeing my friends sitting in the stands supporting me, kind of just that kind of feeds into the fact that this is also a personally rewarding journey that I've gone on, and they've always been my biggest supporters in high school, and I'm just so happy to see how far we've come, how we've all grown throughout college, even though we go to different schools, how we're still such close friends and will be through the rest of our adult lives.